My name is Beth Bedore, and I own a business called The Creative Life by Design. And I am a kidney patient, and I have been on both sides of kidney disease. I have been a provider as a physical therapist, and now I'm a kidney patient. And I decided that if I was going to stay on this earth and have kidney disease, I wanted to support not only myself with my health and my well being, but I wanted to support community. And this is the first support group. I'm expecting a few people here today, but it's a little after 7, and they're going to start on the first Tuesday of every month. This is March, and do you know what today is? Today is Fat Tuesday. So I'm a little crazy if you didn't know. I like to be serious about kidney disease, but let's see if I can find out what I'm doing here. Now, if you have seizures, you don't want to watch this. Let's see if it'll turn on now. With my luck, it won't. Oh, there's the button. Yay! So I don't want to keep it on, but I'm celebrating Mardi Gras and Fat Tuesday. So with that being said, I decided to start this. Oh, it still wants to party. I decided to start this group, like I said, not only for my health and my well-being to have people to talk to and to support, but to have others with me to support and to support community. My support group is going to be a little bit different. My kidney support group is going to be a little bit different than everyone else's. I'm really hoping to bring a group of people together that are very positive in nature. I understand that when we have this disease, that there are lots of different things that go on, and sometimes we need to vent. However, I am not a negative person, and I'm hoping to attract positive people so we can get this through this disease, to either get our transplants, which were never done with this disease. There's always medicines to take, doctor's appointments, but our lifestyle will change, and to make the best of the situation that we have. So my mission is to bring these people together and to discuss both Western medicine and Eastern medicine. I want to bring a collective for diversity. I'm all about diversity. So with different cultures, they have different ideas of what to do with kidney disease, and different cultures treat family members and life situations like this differently. So not only did I want to support one another and be able to have some conversation and support one another, I wanted to do definitely some education. So if you know somebody who has kidney disease, family who's taking care of them, friends that have kidney disease, please have them reach out to me, and they can find me on my website, thecreativelifebydesign.com. And my email, if you need my email, is beth@thecreativelifebydesign.com. So today's topic is going to be about rehab and the kidney patient. And when I talk about rehab, I'm not talking about like for an addiction, unless you're addicted to going to physical therapy and exercising. So I'm going to talk a little bit about each thing. Physical therapy has to do with musculoskeletal, plus many other things. There are so many areas of physical therapy. There's pediatrics, there's home care, there's pelvic floor and women's health, there's burn, there's spinal cords. I could go on and on and on, and I won't. And then occupational therapy generally has to do with what's called activities of daily living. Now, activities of daily living doesn't mean that you're going to go to your job and learn how to do your job. That's more workman's compensation in physical therapy and occupational therapy. This is like, let's say you had a stroke. You're a kidney patient, and unfortunately, your blood pressure was higher for one or another reason. It's in your genes that you had a stroke. So if you have a stroke, hopefully they'll catch it in time. You can go to the hospital. They diagnose you, they get you so you're stable, and then you may have to go to a rehab unit. Now, usually a rehab unit is at a skilled nursing facility, and I call that a SNF setting. And that's where I worked most of my life I can't say at the end of my career, let's say at the interim of my career, because I'm not working right now, and I can explain that. So if you are in a facility and you have kidney kidney disease and you're a patient and you also have had a stroke, what they're going to look at is what your medical needs are. Are they that you need more nursing? Are they that you need some social worker? Maybe you were homeless and living on the street, and now you have to find a place to live with this stroke, with this kidney disease. All different scenarios. And then there's the rehab team. And the rehab team is the occupational therapist, the physical therapist, and the speech. So if you have some problems with cognition or with speech, that would generally go to the speech therapist. Now, not always, sometimes we intermix things, but generally, if you're having problems swallowing, the speech therapist can help you with that. If you're having problems with cognition from the certain part of your brain that got interrupted with the stroke, that may be affected from the stroke, then you're going to want to see a speech person to help you with that. Then there's the occupational therapist. Like I said, activities of daily living. So think about, what would you need to do for activities of daily living? When you get up in the morning, you have to get out of bed. They might not be able to get out of bed. Brush your teeth or take care of your dentures, put on your glasses, put in your hearing aids, right? And if they have a stroke on one side, they might not be able to manipulate all that. Or if their cognition isn't good, right? And then they have to get up and get to the bathroom. So how are they going to get to the bathroom? Wheelchair, cane, walker, independently. And then once they're in the bathroom, you usually can't, one of the people that were supposed to be on here can't get in, and I don't know what to do about that at this moment. I will send him the replay. Let's say that. So you're in the bathroom, then you got to go to the bathroom. So you got to take down your britches, all that kind of jazz, maybe take a shower, need help with that. So it's all those kind of things, along with eating and anything during the day that you have to do. And they work a lot with the arms in a SNF unit in a long-term care setting. And as far as occupational therapy goes, there's some overlapping between PT and OT. Now, in physical therapy, in a nursing home setting, in a skilled nursing home facility, if you have kidney disease and you are there, we're most likely going to help you with getting out of bed, transferring from one place to another, walking, and you may need a walker or a cane. Now that you've had a stroke, it may have affected your one side of your body. I'm going just with strokes since I started with that. So in physical therapy, what we would have to determine with somebody who is a kidney patient, no matter what setting they're in, and I will talk about more different settings and what else we can do besides just teaching them how to walk and get in and out of bed, those kind of things, is like we can deal with pain and all different kinds of things. But generally in a long-term care setting, that's what we would do, is help them with those things. So if they have a problem like with falling from the stroke, then we can teach them their balance. There's all these different things that we can do in a skilled nursing home rehab facility. So let's get back to having a kidney disease, or as I like to call it, dis-ease. I don't like to say I have a disease. I like to say I have a dis-ease. My body is in dis-ease and it's showing up in the kidneys. So with that being said, then, just looking at my phone to see if Tom's getting any luck getting in. So I will learn as I go along, if you can just bear with me through these trials of the first support group. So if you're a kidney patient and you are in a skilled nursing home for rehab, then there's some certain things that we have to monitor because of your kidneys, right? Kidneys help function your body, help cleanse the blood. You can swell up with kidney disease because you may not be able to urinate. Maybe you still urinate, but you still swell up. Your feet all swollen, your belly's all swollen until you get to dialysis or in between dialysis sessions, which are usually 3 days a week for around 4 hours, or you can do it at home. And I'll get into that at some point in time in our sessions, all the different types of dialysis. So 3 times a week, 4 hours. So when you're there for rehab, then um, we have to monitor your blood pressure because your blood pressure can go up and down as the fluids in your body go up and down. Like I said, your oxygen. What if you need oxygen? Maybe you've always needed oxygen, even before you're there. Or maybe now that you've had the stroke, you can't breathe as well. And what they'll do is they'll put this little instrument on your finger. And if you go to the doctors, they do it all the time. And it digitally reads your oxygen level. And your oxygen should be at 100%. If it goes down past 90 or 85, that's really a warning that you're not getting enough oxygen to go ahead and do too much exercise. We need to slow down the pace. So, those are just a couple of things. Other things that we can do as far as rehab in general and with kidney patients is that we can help with musculoskeletal and nerve pain. Yes, they're just like anybody else. Maybe they've had a back issue for years, or maybe they have a dropped foot. I'll be able to talk here sooner or later. A dropped foot from the stroke. That could happen. So you can get a support in your shoe, what's called an ankle foot orthosis, and they can help you with the pain with your back. We have several different modalities that we use. Hands on. It's great with therapists. Let them use their hands. We're so busy going into the computer and putting all the information into the computer that we're not doing as much hands-on with our patient as we used to. But when you go to good facilities for rehab, they will put their hands on you for some issues that you might have. Different modalities, ultrasound units for pain. Electrical stim can be for pain, like a TENS unit. You might have heard of a TENS unit. That could be for pain. And it puts a little stimulus into your muscles. So your body, it's like they call it the cycle of pain, the gate cycle of pain, where it stops your brain from experience the pain as much. And so it's a big circle from your muscle, wherever it is, your back muscles, your big back muscles, to your brain, and then back down to your back muscles. So that kind of interrupts the signal. Sometimes they use hot and cold, and I would suggest really doing hot and cold at home. And with any of these activities, anytime I talk about exercise, anytime I talk about herbs, anytime I talk about doing a new regimen, you need to let your doctor know. Because as everybody knows, when it comes to kidney patients and kidney disease, it's very regimented on what they want us to do as far as diet, as far as how much you drink, all these different things, taking your medicines on time, especially if you've had a transplant, then you better take your medicines on time. You know why? I mean, most of us do, but maybe if you're new to this, you might not know. And you could reject, that's the right word, reject the kidney if you don't take your meds on time. So all those things are important. There's pediatrics for kids that are developmentally delayed. There's physical therapy for burn patients if you have a burn. Now, some places will just have a burn unit, depending on how bad the burn is. Wound care. We do wound care sometimes, but a lot of the skilled nursing facilities, the nurses now, they have a nurse that does the wound care. But they do have physical therapists that specialize in that. So if you're a diabetic and you're a kidney patient, you might get an ulcer on your foot, let's just say. I've seen a lot of that because I have been a physical therapist for over 30 years. And boy, have I seen a lot. So they can help with that. Women have pelvic floor issues sometimes. And there are specific people out there that deal with that. And part of it is physical therapy, women's health. So if you have problems with bowel, with bladder, with sexual function, those kind of things, you could ask your doctor to refer you to a physical therapist like that. Or if you know of one or know a therapist that can refer you to one, then that would be helpful also. Because just when we're a patient and we have kidney disease doesn't mean that we don't have other diseases and other things going on with our body, just like anybody else. Everything's connected. Your knee bone's connected to your hip bone. That song when you were a kid, right? So that's a little bit about kidney disease and rehab. And I think the people that said they would be on this are having some difficulties getting on. So I'm going to stop the recording, and you know how to find me, Beth Bedore, and my website is thecreativelifebydesign.com. And you can find me on Facebook, Beth Bedore, and Never Say Never is another way. And I will keep posting these things on Facebook. It's the first Tuesday of every month at 7 o'clock Eastern Standard Time. I will get this resolved with Zoom. And happy Mardi Gras. And I'm going to see what's going on. Maybe we can bring them in after all.